Hello, my friends. This episode, we're going to be talking about surgery and surgeon, and specifically scoliosis surgery and surgeon. Surgery for scoliosis treatment is a very important aspect, and the surgeon considered one of the most important member on the team that dealing with scoliosis management. What I'm trying to say is there's a scoliosis clinician, there's a physiotherapist, orthotist that do the devices and stuff, and surgeon complete the circle, and it's one of the um, most important member in the team that approach to scoliosis. And there's surgery for scoliosis is one of the most important modalities and procedures that can be done sometimes to save lives and sometimes to give the patient the quality of life that he deserves and take him out of his misery. Surgery by far, in particular in some type of scoliosis, is the only approach that can be done for certain type of scoliosis. For example, the early onset scoliosis, congenital syndromic scoliosis. Uh, Surgery is like number one on the ladder for the treatment and management. But surgery is so much different from surgeons because surgeons by far there is majority that affiliated with their members, with their team members, affiliated with institutes, um, are encouraging themselves to learn and to follow research and to share their experience along the span of, we're talking now almost half century of surgery um, being done on the vertebral column or the spine surgery. On the other hand, there is very few surgeons. They are practicing, they are all over the place. They have no idea about this concept of group management of scoliosis patients. They have no idea about the conservative treatment as far as, for example, bracing, exercise, sports. They didn't even have a chance. They didn't even bother to just read what's been out, more than 1,000 paper literature out with different modalities, and all go in one direction for the patient benefit. I hope those surgeons will take a look at this presentation here, because it's so critical. As much as the scoliotic patient needs a surgeon in his team, management team, he also needs those other members. He needs a physiotherapist, he needs the orthotist for the right bracing, he needs the scoliosis clinician for the right diagnosis and right approach. And on this slide here, I picked up, in my opinion, there's tons of nice organization all over the world, but those by far are, in my opinion, is like top of the notch. The SRS, Scoliosis Research Society, those are group of 125 surgeons, top spine surgeon from all over the world. The Pediatric Spine Study Group, 150 plus surgeons from all over the world. The SUSORT, the International Society of Scoliosis Orthopedic and Rehabilitation Treatment, and their guides, their guideline or guidance. They have a guide and was new. It's new every year. 2016, I believe. There's one in 2020. But what I'm trying to say, those big institutes, they have the most famous names in the spine surgery all over the world. What they do, they are under continuous scientific sharing and discussing an evaluation of different scoliosis approaches, techniques and procedures, and effectiveness of each procedure. What do we do here? What we don't do here? They try, the collective aim is to achieve premium diagnosis, premium procedures, and the premium prognosis for our patients. And they have they share a lot of their techniques and ways of doing stuff and putting the format together for curvature, size and site and magnitude, flexibility, morphology, bone quality, associated deformities, age, the growing maturity stages, the quality of life versus complication of surgical complication, either general complication or specific for scoliotic patient. Us as a scoliotic clinician and PT and orthotist, I would recommend them to always follow this particular institutes and to be aware of, we know that surgery is very important aspect in our management for our patients. We know it's the most, in some cases, it's the only way to manage the case. And in different cases, it's very important way also to manage the case. Till we reach the surgical decision, which is a surgeon as a member, one of the member of the team of the new team approach for the last 4 or 5 years all over the world. Surgeon take the decision, and the whole aim of all this studying and researches and institutes, do no harm for the patient. Do not harm your patient. Don't be one of these surgeons that he also know couple techniques, Harrington Rhodes, posterior osteotomy, and here we go, and next patient, and here we go, and next patient. Nope, there is tons of new techniques available. Prepare yourself to upgrade your knowledge in surgery techniques for the sake of your patient and for the sake of your management group. This is so critical. I cannot emphasize this enough. I've seen some premium surgeon that we learn a lot from them, and I've seen on the other hand the surgeon that they don't know what the Schross method is, what kind of brace is available, what's the advantage of bracing or doing a specific exercise. They don't know. They never heard about it. So I just found myself, I practiced surgery before, practiced general surgery, and I know how busy you could be on your ER, on your schedule or whatever, but dealing with scoliosis is totally different animal. There is tons of research in the last 5 to 10 years talking about conservative treatment, give your patient a chance for the optimum prognosis. And I just here also get involved with the surgeon, with your surgeon, to know, is this candidate or this patient are more candidate to a fusion or non-fusion surgery? What kind of non-fusion? Is it the vertebral body tethering, for example, anterior scoliosis correction or anterior spine correction, epiplex, disc release? What's the advantage of disc releases? Corneal osteotomy, iliac fusion, when we do iliac fusion, when we don't, when we use hyper technique, in all different types of scoliosis, early onset, adolescent idiopathic, the majority, even the adult scoliosis, even the degenerative scoliosis. There is no excuse for us not to know at least the titles and the details of each technique. And YouTube is loaded with lots of good doctors from all over the world explaining when we do disc release, what's the controversy about disc release? What's the candidate for the right epifix technique? When we transfer from VBT to ASC, when we do iliac fusion, and it has a lot related for ambulance, and afterwards, what's the complication for this particular case? And as we know, there's so much cases, especially in the early onset scoliosis, surgeon works alongside with the, for example, the casting masters or the casting people, the bracing people, the BT, the physical therapist, exercise, and all this new nice school that offer even for the preparation of the surgery, certain exercise will reduce the risk of post-surgical complication. We need to know bits and pieces about these techniques, at least to understand when we discuss with any surgeon, we have a common ground to discuss. And the surgeon, on the other hand, need to listen to or to research or review the research results for the wonderful conservative treatments that is available all over the world that reduces and prevents surgery when it's unnecessarily for our scoliotic patients. And it's not a routine surgery that I just, oh, I'll make 10 different. I've seen some surgeons that so proud that they are corrected 45 degrees asymptomatic, you know, just with road, and it's so much politics and so much I don't want to say bad stuff, but scoliotic patient, it's a long journey for management, and it shouldn't be this way when it comes to surgery if it was on the table as an option. It has to be very, very selectively, highly selected cases for a particular reason. Exactly the same like bracing. Some patients are not allowed to have braces. It's just a good modality, and it's a very important modality that need to be managed properly and ethically. And again, this channel just to enlighten all scoliotic clinician and fill the gaps between different specialties that deals with scoliotic patient through the scientific literature and research paper. My name is Wael Abdullah, and I thank you for listening, and I'll see you next time. I think our next episode will talk about the exercise and sports, particularly for scoliotic patients. Thank you, and you have a great day.